Greetings, and thank you for joining me again this week for my weekly video message. Earlier this week, the Food and Drug Administration granted full approval to Pfizer's COVID-19 vaccine for people 16 and older, making it the first to move beyond emergency use status in the United States. The vaccine continues to be authorized for emergency use for children 12 to 15, while Pfizer collects the data required for full approval. A decision on whether to authorize the vaccine for children under 12 is likely to still be a few months away. For those who are 12 and older and have not been vaccinated, I hope that this news encourages you to get your shot now. Our vaccination rates are among the best in the nation, but unfortunately we continue to see our daily COVID cases increase again. And yesterday we had 141 cases. And it's kept us in the substantial transmission level according to the CDC. This means that our indoor mask mandate remains in effect. In fact, our COVID case rates are the highest they've been since last winter. And if you remember, it was only a month or two ago when our daily cases were under 10. So this is a pretty significant change, even with many of the cases occurring in the unvaccinated population. Earlier this week, the Maryland Association of Counties notified attendees, and I was one of them, who were at their conference last week in Ocean City, that several people who were there tested positive for COVID. When I learned this, I immediately got tested, and I'm happy to report the results came back negative. I am vaccinated, I feel fine, but I know that I still could get sick and I'd be a carrier, so I got tested. This is what we all need to do when we're notified that we're exposed, even if you are vaccinated. At the Mako conference, it was probably less than 50-50 on who was masked indoors and who wasn't. And the fact that an outbreak may have occurred is no surprise. This situation is a reminder for everyone who's been traveling on vacation and returning to the county to be mindful of your health and to please get tested when you return, particularly if you're traveling to one of those states where COVID is running wild. What happened in Mako is a good example of why we are following the CDC guidelines and mandating indoor masking while we are in the category of substantial transmission. And our rates compared to the Eastern Shore jurisdictions prove why this is a good idea. I continue to be concerned because the unvaccinated are making both vaccinated and unvaccinated people sick. This is a solvable problem, and it is the unvaccinated people who stand as the largest obstacles to our path of getting back to normal. I know when I go out that even though venues like restaurants are open, they're not back to the pre-COVID sales levels. And when I talk to people about what they will or won't do, going to restaurants indoors is one thing where people express hesitancy because being unmasked, which is what you have to do when you're eating, they know that the exposure risk is greater and there's no way to know whether the people around you have been vaccinated or tested. Theaters and restaurants are increasingly requiring people to provide proof of vaccination or recent tests to gain admission. And I hope that all businesses that either have large crowds or situations like restaurants will mandate people to show proof of testing or vaccination as a condition of admission. Increasing customer confidence in the safety of our businesses will help get people to return to the activities they would like to resume. With almost 95% of our population over 12 having one dose and around 86% having 2 doses, the number of people who may not be able to enter a business with these restrictions is small, but the number of people who could enter your business if they felt it was safe is large. These requirements are good for business and good for the community. People want to go out and have fun without anxiety. Patronizing establishments that will require proof to encourage others to do so, and the fewer places the unvaccinated can go without being regularly tested will incentivize them to get vaccinated. We need to get to 80 to 85% fully vaccinated population to be able to really control this virus and its mutations, and we will likely be one of the communities that'll be able to do that. But if the rest of our state and nation can't get there and we max out at 70 to 75% fully vaccinated, including third shots and boosters, we better be prepared to live with this virus for a long time and having eternal vigilance regarding it. And people have to remember that the more infections, the more mutations that will emerge. And everything we do to prevent the virus from spreading and reproducing helps us to limit the number of mutations that might arise. We've already seen how mutations can be worse than the original version, and health officials continue to be concerned about the emergence of variants that are more resistant to vaccines. None of us want that to happen, and we have the ability to reduce the risk of that happening by all of us, here and everywhere, getting vaccinated. That is why I've kept supporting and wanting to see more workplaces require vaccine or proof of testing. And this week I announced that following very thoughtful discussions with our labor partners, Montgomery County employees will be notified that they have to submit documentation by September 18th that they are vaccinated, or they will begin to be required to undergo regular COVID testing and provide proof of results. I'm appreciative of the hard work and diligence of all parties involved to ensure that we do this correctly to protect the rights and privacy of our workers, as well as the health and safety of all of our employees and all of the public that we serve. Additionally, the CDC, FDA, and other national medical and public health experts are recommending a booster shot for American adults 18 and over who are fully vaccinated with Pfizer or Moderna shots. The guidance files reports that the protection the Pfizer vaccine provides may start to decrease after 8 months. The recommendation for a booster shot is for 8 months after becoming fully vaccinated. So for those who received their shots in January and February, that could be as early as mid-September. Many of our healthcare workers and first responders received their vaccines first, and they would be the first to get the boosters. And of course, seniors, which were our second group, will come immediately after. And we've created contingency plans as well as working with the state and federal officials to ensure that our booster program runs effectively and efficiently. Because we know when you got vaccinated, we also know when you will need your booster. So we can plan the distribution in a way that's far better organized than it was in the spring when everybody was scrambling to get shots without the supply needed to vaccinate everyone at once. Next week, the 2021-22 school year kicks off. This is an exciting time for our students, teachers, and staff at MCPS and all the schools throughout Montgomery County. After nearly a year and a half of school being online or hybrid, 5-day-week in-class instruction returns. Our students need this return to classrooms and to learn with their peers. This is not going to be easy, and we must be ready to face challenges from COVID outbreaks. MCPS has worked very hard to create a safe environment for students as well as plans for disruptions from potential outbreaks. One school issue that we have had many conversations about over the past year is around the future of the school resource officers in our school buildings. During our budget rollout last March, I was unequivocal that SROs were going to be removed from our school buildings, and that has come to fruition. SROs will now be renamed Community Engagement Officers and will not be in the schools as was designated by the SRO program. The school cluster plan will be instituted on Monday, and the community engagement officers will oversee their assigned cluster. These officers will only respond to schools on an as-needed basis or calls for service. Enforcement of school policy issues will not become police issues, and schools will contact 911 for any issues, not individual officers. Police and schools will meet once a month to discuss issues as they arise. Our next step will be a more in-depth working group on providing a broader range of services and involve other agencies. Acting Superintendent McKnight said today that the much anticipated increase in mental health supports will begin appearing in schools this fall. With brutally hot weather continuing this week, devastating rains, storms throughout the summer, wildfires out west and in Europe, and tropical storms and hurricanes hitting everywhere from the Caribbean to New England, it is evident that the impacts from climate change are happening now in real time. This week, I'm pleased to announce that Adriana Hochberg, currently one of our Assistant Chief Administrative Officers, will now serve as our county's first climate change officer. For the past year, Adriana has spearheaded the development of Montgomery County's bold new Climate Action Plan. This action plan will guide the county toward its goals of reducing greenhouse gas emissions by 80% by 2027 and 100% by 2035 when compared to 2005 levels. Our new plan is one of the most ambitious and aggressive local government climate plans in the nation and will help us increase resilience in the face of growing climate hazards. In her new role as Climate Change Officer, Adriana will lead the county's implementation of this critical plan. I want to remind everyone that there are major parts of this plan that will require council approval and cannot simply be implemented by me. There is a lot we need to do, but I'm optimistic that with greater federal support, along with the evolution of more implementable solutions that we've seen, we will be able to make significant progress. I respect her commitment to this work and her willingness to serve Montgomery County in this new capacity. Finally, I want to send my condolences to the family of Axel Trejos, who was killed near the Plumgar Rec Center last Wednesday night. This was a tragedy, and I want to thank and acknowledge our Up-County Regional Center for being on the scene and able to help this family and community at such a tough time. The Up-County Regional Center helped raise $1,200, which was paid to All Souls Cemetery to assist this family during this difficult time. Our regional centers are epicenters of outreach and resources to the communities they serve. I encourage all residents and businesses to get to know our staffs in these centers, and please let us know how we can help. Thanks for tuning in, and enjoy your weekend.